Jessica Lee. I'm an associate professor in the Department of Neurology and work in the Division of Cerebrovascular Disease. Yeah, so I would say probably 99% of my practice is stroke. That is my subspecialty area. And so all my hospital time I spend on the stroke service, which here is very, very busy. And in the outpatient clinic, I see new consults who are coming in for opinions about stroke or a question of whether they've had a stroke, but also see our follow-up patients who may have been in the hospital and actually get to watch them go through some of their recovery. When I was a young child, saw my grandfather go through, kind of end-of-life illness in the nursing home, and so I always wanted to be a doctor. What I wanted to do changed over the years, and often was the biggest word I knew at the time. But ultimately, in medical school, thought I wanted to go into pediatrics. Did my pediatrics rotation, realized that was not for me, and rotated through neurology and just loved it. I love that you kind of have to play a detective a little bit with neurological patients. It really is about taking a history and getting to know the story behind the reason they're there. Well, I think we need, as doctors, to see all of our patients as individuals. We have guidelines regarding secondary prevention, primary prevention, certain types of stroke, but ultimately we have to individualize care. And what I've come to realize over the last several years is that at least current medical science only takes us so far. So over the last few years, I've really become quite interested in some alternative therapies, particularly music and art. When I joined the University of Kentucky in 2012, one of the things that I was charged with was developing a stroke fellowship or vascular neurology fellowship. So that's advanced training for neurology graduates who want to get that subspecialty expertise in taking care of stroke patients. And we've done that. But in addition, about less than a year into my time here at UK, I took on the role of medical director of the comprehensive stroke program here at UK HealthCare. And in my role as the director, really I'm responsible for all the program oversight. And as a comprehensive stroke center, we take care of the most complex stroke patients. We are a 24/7, 365 day a year service. We are never on divert, we are never closed, and so it can be quite busy, but it's also very rewarding because we can really take those patients who are in the critical moments and, in many cases make tremendous impacts that affect their long-term quality of life.